Welcome everyone. My name is Nataka Johnson. Today I'll be presenting a comprehensive overview of heart failure. This includes its causes, epidemiology, pathophysiology, clinical manifestations, treatment options, and strategies for care coordination. Let's begin by looking at what heart failure really is. Heart failure is a complex clinical syndrome where the heart is unable to pump significant blood to meet the body's needs. It results from structural and functional cardiac disorders and can be classified as systolic or diastolic failure. Most recently, classification include heart failure with reduced ejection fraction and preserved ejection fraction. Understanding these distinctions is critical for diagnosis and treatment planning. The leading causes of heart failure include coronary artery disease, hypertension, myocardial infarction, and cardiomyopathy. Risk factors such as smoking, obesity, diabetes, family history, and sedentary lifestyle significantly increases the likelihood of developing heart failure. Addressing these risk factors, is essential for prevention and early intervention. The latest findings on heart failure, published by the Heart Failure Society of America, reveals a concerning rise in the prevalence, mortality, and impact of this debilitating condition in the United States. According to the HF Stats 2024 Heart Failure Epidemiology and Outcome Statistics, approximately 6.7 million Americans over the age of 20 currently live with heart failure, a figure projected to rise to 8.5 million by 2030, 10.3 million by 2040, and a staggering 11.4 million by 2050. The report was published in the Journal of Cardiac Failure. This year's finding underscores some of the most alarming trends seen in heart failure in recent years. While heart failure rates have steadily increased over the last decade, the 2024 report shows that the problem is growing even more severe, particularly in younger populations, racial and ethnic minority groups, and those with multiple health conditions. In the US alone, over 6 million adults have heart failure. It is more common in older adults and those with multiple comorbidities. It is particularly prevalent among individuals over the age of 65 and is a leading cause of hospital admissions in older adults and one of the highest causes of death. Hospitalizations and readmission rates remain high. The burden of heart failure is rising due to an aging global population and the increasing prevalence of lifestyle-related diseases such as obesity, diabetes, and hypertension. Approximately 1 in 4 persons will develop heart failure in their lifetime. These trends underscore the needs for effective prevention, early diagnosis, and comprehensive management strategies to mitigate the impact of heart failure on public health systems. Heart failure is classified based on ejection fraction into two main types: heart failure with reduced ejection fraction and heart failure with preserved ejection fraction. The disease typically progresses from an asymptomatic phase to a symptomatic stage and eventually to advanced heart failure. The New York Heart Association functional classification is commonly used to assess the severity of symptoms and functional limitations in four stages ranging from Class 1, no symptoms, to Class 4, symptoms at rest. Understanding these classifications helps guide treatment decisions and prognostic assessments. The four stages are defined by the ACC and American Heart Association as the following. Stage A, high risk, no symptoms. For example, patients at risk for heart failure but without current or prior symptoms or signs of heart failure and without structural or biomarkers evidence of heart failure. Stage B, structural disease, no symptoms. Example, patient without current or prior symptoms or signs of heart failure, but evidence of structural heart disease or abnormal cardiac function or elevated peptide levels. Stage C, structural disease with symptoms. This patient is with current or prior symptoms and signs of heart failure caused by a structural or functional cardiac abnormality. And stage D, refractory symptoms despite treatment. This is the heart failure. This is the advanced heart failure where patients with severe symptoms and signs of heart failure at rest. These patients have recurrent hospital stays despite guideline-directed management and therapy. Early identification and intervention can slow progression and improve outcomes. Symptoms of left-sided heart failure include dyspnea, fatigue, orthopnea, and pulmonary congestion. Right-sided heart failure presents with peripheral edema, ascites, hepatomegaly, and jugular vein distension. Other symptoms include weight gain, nocturia, and exercise intolerance. Recognizing these signs is crucial for timely diagnosis and management. Common comorbid conditions in heart failure patients include hypertension, chronic kidney disease, diabetes, anemia, sleep apnea, and depression. These conditions complicate management and increase mortality risks, necessitating a multidisciplinary approach to care. The goals of heart failure management are to relieve symptoms, slow disease progression, and improve quality of life. Preventing heart failure involves controlling modifiable risk factors such as hypertension, diabetes, and unhealthy lifestyle habits. Pharmacological treatments include ACE inhibitors or ARBs, beta blockers, SGLT inhibitors, and aldosterone antagonists, which have been shown to improve outcomes in patients with heart failure ejection fractions. Non-pharmacological interventions include lifestyle modifications such as regular exercise, dietary sodium restrictions, and and participation in cardiac rehabilitation programs. These strategies aim to reduce symptoms, prevent hospitalization, and improve quality of life. Advanced therapies for heart failure include implantable cardioverter defibrillators or ICDs, cardiac resynchronization therapy CRTs, left ventricular assisted device LVADs, and heart transplantations. Emerging therapies include gene therapy targeting cardiomyopathy, stem cell therapy for myocardial regeneration, and novel agents like ARNI. AI-based remote monitoring is also being explored for early detection of decompensation. These innovations hold promise for improving outcomes. Recent clinical trials like the Paradigm and Inferior Reduced have provided robust evidence supporting the efficacy of these new treatments, paving the way for future innovations in heart failure management. Effective management of heart failure requires regular evaluation and therapeutic response through tracking symptoms, weight, vitals, BNP levels, and echocardiograms. Follow-up visitations are recommended every 3 to 6 months or sooner based on clinical status. Coordination of care involves a collaboration among cardiologists, nurses, dietitians, pharmacists, and home care providers to address the complex needs of heart failure patients to enhance patient outcomes and continuity of care. Patient education is a cornerstone of heart failure management. Key topics include daily weight monitoring, medication adherence, symptom recognition, dietary modification, and physical activity. Barriers to effective education and adherence include socio-economic factors such as medication costs, transportation, social, psychosocial issues such as depression, low health literacy, and lifestyle habits such as poor diet, smoking, and alcohol use. Strategies to overcome these barriers include the Teach Back method, motivational interviewing, and telehealth follow-up to reinforce learning and support behavioral change. Empowering patients with knowledge helps prevent decompensation and improve self-management. Evidence-based practice in heart failure is guided by landmark studies and clinical guidelines. Key publications include Veridem, DAPA, Imperial Reduce, an ACC/AHA 2022 Heart Failure Guide, and one more, a JACC 2023 review on future directions. These studies provide critical aspects to efficacy of pharmacological and device-based therapies, shaping clinical decision-making and improving patient outcomes. Incorporating evidence into practice ensures that care is aligned with the latest standards and innovations. In conclusion, heart failure is a prevalent and complex condition that requires early detection, guideline-directed medical therapy, and a multidisciplinary approach to care. Key takeaways include understanding the disease process, recognizing signs and symptoms, implementing effective treatment strategies, and coordinating care across specialties. Looking ahead, advancements in research and technology hold promise for improving outcomes and quality of life for patients with heart failure. Thank you.